Football fans were stunned this week when Buffalo Bills safety Damar Hamlin collapsed in cardiac arrest during his team's game against the Cincinnati Bengals. Well, this has raised many questions about what happened and why. Joining us from MUSC, Dr. Jeffrey Winterfield, Chief of Electrophysiology. It's great to have you with us.
Thank you for having me.
People have so many questions about this, how someone so young, he was only 24 years old, when he suffered cardiac arrest, he actually died on the field before he was brought back. Could happen to somebody. So maybe you can explain a little bit about the physiology of an event like this.
Sure. Well, I think cardiac arrest is first the key term here, and there's an important distinction between cardiac arrest and heart attack, and most lay people will call a heart attack or confuse a heart attack and a cardiac arrest.
Yeah.
Two different things. Okay, so this football player sustained a cardiac arrest on the field, which means his heart electrically went into disarray, resulting in an abrupt loss of blood flow to the brain primarily, which results in that loss of consciousness and him dropping so precipitously as he appeared to do on live television. A heart attack is a little bit different, okay, a lot different really. It's a abrupt blockage of a coronary artery that results in a loss of blood flow to an area of the heart, commonly associated with symptoms or prodrome of chest discomfort, shortness of breath, lightheadedness, sometimes gastrointestinal discomfort, jaw pain, shoulder pain.
Signs that lead up to
Correct.
that. Okay.
Very different. Not as many warnings. Cardiac arrest strikes like lightning. It's very abrupt.
Okay.
Some heart attacks can lead to a cardiac arrest if it's bad enough, but a cardiac arrest is a consequence of the primary rhythm is something called ventricular fibrillation. And as one of my colleagues has referred to it, it's like a bag of worms. It's just this fluttering or just jiggling of the heart. And when the heart is doing that, instead of squeezing and generating good force to contract and eject blood out to the heart and to the brain, it's unable to do that because it's not able to generate that force.
So someone who's so young, at 24 years old, the force that it took to create that cardiac arrest, I mean, it had to have been tremendous. This isn't necessarily the first time something like this has happened, but what is it about the force against the chest that would cause the cardiac arrest to occur?
Well, it's a great question. The assumption here is that the force applied to the chest during the tackle resulted in the triggering of this arrhythmia and the cardiac arrest that we all witnessed on the field. Assuming that's the case, and that's a reasonable assumption based upon a number of experts reviewing the video, the speculation is that the temporal relationship between that hit, him going down and within 6 seconds standing up and then dropping, suggests that he suffered an arrhythmia triggered by that tackle, likely by the force of contact of that helmet very focally on the chest wall, just at the level, just leftward of the breastbone, which is exactly where the heart sits.
So with the limited information that we do have about exactly what happened, it sounds like the needle was threaded just so that each event kind of happened in a way that resulted in him actually dying on the field.
That's right. It's almost like two lightning bolts striking at the same time in some sense, both incredibly random and incredibly rare. So you have to strike at precisely the right time in the cardiac cycle and with enough force. And there is almost a bell curve. If you have too much force, it won't do it. Too little force, it won't do it. If it's just right, it will, and at the right time, it will trigger this arrhythmia. And
with professional football, the way those players tackle each other and the way they just run at full force right into somebody, it's amazing that this doesn't happen more often. That's very true. But fortunately, at least according to published literature, this is very rare. This type of injury, it's called commodio cordis, which means a disruption of the heart or disarray of the heart in Latin. And there's maybe 15 to 20 cases a year that have been published. The mechanism of this has been investigated thoroughly by a colleague in Dallas, Texas, at the University of Texas Southwestern, a physician named Dr. Mark Link. He's the chair VP there.
and has really done some very beautiful seminal work in investigating the mechanism and actually making some changes based upon his work to the quality and safety of protective gear used in contact sports.
Yeah, of course. And with just about 30 seconds left, of course, timing is of the essence. So knowing CPR and being able to rush to somebody's aid in time to start pumping the blood again to bring oxygen to the brain.
What this case highlights is the importance of recognizing the signs of cardiac arrest and providing immediate supportive care with good CPR and a rapid defibrillation with an automated external defibrillator, or AED, which are commonly available in public spaces.
Right. And from a doctor's perspective, CPR, you just keep pumping to staying alive. That's what I've always heard.
That's
you don't
right.
have to do mouth to mouth necessarily.
You
just keep pumping that chest until help arrives.
That's right. You want to do good chest compressions until help arrives, get the defibrillator, apply the pads. You can go to the AHA website, the American College of Cardiology website, or the American Red Cross website.
We're going to put that information up on our screen, absolutely. So staying alive, get to know your Bee Gees, everybody. Thank you so much, Doctor.
Thank
Appreciate
you.
your time.
All
We're
right.
back after this.